Because of the widening spread, I've asked everyone to shelter in place here in Norman with our stay-at-home order. It's the only way to flatten the curve and allow our healthcare system to handle the influx of patients with COVID-19, along with patients from everyday emergencies. I've partnered with Norman Regional Health System to make sure you all have the latest information about the virus. Joining me today to talk about it is Dr. Richard Kirkpatrick with Ortho Central. Dr. Kirkpatrick, thanks for taking the time to update us today.
No problem. Thanks for having us.
So first of all, you're an orthopedic surgeon. Tell us, how is this affecting your day-to-day work?
Well, from an orthopedic surgeon standpoint, it's been a huge change to the way that we practice. For instance, on the Sunday that we forgot the first diagnosis in Cleveland County, I was in touch with all the representatives from the hospital here. I typically do elective outpatient cases and total joints on Monday. And so I made a decision to cancel all those elective cases at that point. And so most of the surgery that we do in an orthopedic standpoint is elective, meaning that we can postpone that for certain periods of time. Some of it's not, certainly fracture care and acute injuries that need to be addressed. We'll address those just like I did this morning on a case, but most of those cases are elective, so we've pushed those off. We've also tried to limit the exposure of patients to our clinic because that's an area we can have mass populations of people in small areas. And so we see the people we really need to see. We see them one at a time so they can be in the clinic and out of the clinic for this exposure to other folks. We're using rooms that they're in, and that room is terminally cleaned or sterilized before another patient comes in. And then we're also transitioned over to doing virtual visits so we can do a lot of things via technology that really has been an eye-opener for me. So some of the silver lining in this big storm is our ability to see some of these patients virtually that may help us in the future kind of open that avenue up.
Yeah, I've often said that, when the dust settles and we've moved past this, which feels like an eternity away, but will come eventually, we'll actually be in a better position as a society as a whole from the leaps and bounds that we've made in terms of technology and access.
Correct, absolutely.
So with your limiting of elective surgeries and cutting down on appointments, I know that many national associations like the dental associations and even optometrists have recommended the same thing, that now is not the time for routine checkups. Those can be delayed a bit and save it only for emergencies. Is that something you would recommend for any of our doctors that are contemplating, should I stay open, should I not, or how should I alter my business?
Yeah, I absolutely would. I think there's two facets to that. The one that we talk about a lot is personal protective equipment. If I'm seeing patients in the clinic or doing surgeries, I'm utilizing personal protective equipment that may need to be there for emergent things or hospital use or for healthcare providers down the road. The second facet is when we're asking people to try to avoid crowds or being in groups or avoiding exposure, then if we bring them into clinic, we're doing just the opposite of that at this point. So certainly there's things that are emergent that we need to see folks for, but if we can avoid bringing folks in for reasons that aren't emergent, I think that's better for the overall public, for sure.
And you spoke about social distancing right now, we're in, day 5 of our stay-at-home order and having that in place. I know that people are getting bored and cooped up, and now it's raining outside, so it kind of is salt in the wound. But can you speak to the importance of social distancing at this time?
Yeah, it's definitely a very difficult time. My kids are all home, and for the first few days, we all thought that was great, and now it's they're the walls down. I've got a daughter who's at the University of Arkansas and just started nursing school, and she had to have her year cut short and come home. That's tough. I've got a daughter who's a gymnast, and she can't go to practice, and she's scratching the walls too. And so it's a very difficult time, but it's needed right now that every exposure to another person isn't you see a lot of times this example of a matchstick and he moves out of the way and it doesn't continue down the road. It's more than that. It's exponential growth, not linear growth, the way these things spread. And so it takes multiple people the further down the chain to get out of the way. And so if we can break that early on, the better off we'll be. And so that type of distancing is required at this point. And so I urge people to continue to follow those guidelines and follow the you put out as well, because that's the best thing for us right now. I think into a sense of security by looking at the number of positive cases that we have in our community too, and saying there's only X number of cases. Well, those are X number of cases that have been tested that are positive. Most of the folks that come in with symptoms aren't tested. They're sent home They typically try to go through those symptoms and at treatment at home, and we're not wasting those tests because those are in short supply. And so the number of people that we actually have with this disease in our community now is probably many times what we have in regards to positive tests. And so those people could be at the store and other places where you might be gathering. You could be exposed to that without even knowing.
And what I've tried to share with residents is social distancing is important, but this is kind of an invisible person or issue that we're up against. So pretend that you have it. Pretend that
Correct.
so you need to stay away from people. And again, the vast majority of people who contract COVID-19 will be fine eventually.
Right.
And so, especially for you young people, with us being a college town, the point is, while you may be fine, you may pass it on to someone who's immunocompromised or at risk in another way. And that's what we need to be mindful of.
Absolutely. And that's the way I kind of view myself personally. I think if people would take it that way, that we're not trying necessarily to protect ourselves from getting sick from other people, but that we're in fact the vector that we're trying to avoid passing to other people is the best way of looking at it. And certainly from a healthcare provider standpoint, that's the way I function. And on top of that, with my family, I try to make sure that they understand that they're in the same circumstance I am. They're exposed to me, therefore they have it theoretically. And so we want to avoid them having large gatherings with their friends. Like my daughters really want to get together with their friends, and we haven't them allowed to do that because this that we need to take serious right now.
Well, I've told everyone, just blame it on Mayor Clark. I got big shoulders. I can handle it. But with COVID-19, there's been a lot of comparisons to the flu. Is this more contagious than the flu?
Well, I would certainly allow the infectious disease specialists and internal medicine doctors that are really on the front lines of treating this to deal with that. But it feels like it is to me. Probably the most important thing too is to know that this is a novel virus that we have not been exposed to before. And so with the flu, even though there's different types of flu strains, we've gone through generations of being exposed to that type of virus and have somewhat of a built-in immunity systems toward that. But with this COVID-19, we don't have any of that. In now, 2 years from now, 5 years from now, we will. It'll be on another list of COVID viruses that are out there. But at this point, because it's novel, it's much more serious.
And there's no vaccine, correct?
No vaccine, no.
Okay.
And we always think about, we constantly try to think that medicine is going to come up with a vaccine that's going to be simple and easy to do. That's not always the case. Vaccines are difficult. Some vaccines work very well. Some vaccines don't. It takes oftentimes months to years to develop those. And you have to make sure that they're safe before you put that vaccine out to a large population of people. So there's a lot of work to go into a vaccine. And so we can't sit and be lulled by the thought that medicine is going to come up with a vaccine in the next few months and we can go out and do whatever we want to do. We need to deal with that first by social distancing, stopping the spread, the learning new treatments for it and how to treat patients for it is certainly very important. But from a society standpoint, doing our part to try to limit that spread is the most important part.
And the great part is if we just do it, it's really not that hard. It doesn't cost money to social distance or anything like that. It's a conscious, responsible choice we can all make.
Absolutely not. And it does cost money when you look at it from the long term. If we do it in a halfway measure and we continue to have this exposure because people don't take the social distancing and the trying to stay away and limit the spread seriously now, then you have this continued trickle that affects our local businesses and economy for a much longer period of time. And so if you can pull the Band-Aid off and do what's right now, limit that spread, the sooner we can open things back up and get back to work.
No, I agree. And I definitely appreciate your comments and want to clarify mine. What I kind of meant was it doesn't cost money to, like you would go to a movie theater, but it very much does cost money in terms of people losing their jobs. We're seeing the highest unemployment rates in history. I know that here in United Way, the United Way of Norman here in our community is helping people pay bills and utilities. And they had a whopping $16,000 in requests in 2 days.
Yeah,
so I know it'll take us a while to recover from this, no doubt. But the faster that we social distance, the faster we get there. So I appreciate you saying that. But to pivot just a little bit, I know you've been in touch with your colleagues at local hospitals. What types of symptoms are they seeing in regards to COVID-19?
Well, I think the symptoms are along the spectrum of of relatively mild symptoms, flu-like symptoms or mild flu-like symptoms, all the way up to folks coming in severe respiratory distress. I've heard stories of patients that come in the emergency room and within a couple of hours are critically ill, if not passed away already. So really is a broad range of symptoms, which is really, I mean, it's that's kind of the scary part, is you just don't know which end of that spectrum you're going to be on.
Mhm.
That young people, of which I don't qualify anymore, I'm kind of that middle-aged group, but young people can tend to be lulled into thinking, yeah, this is a disease that affects primarily older people in regards to mortality. However, young patients are admitted to the hospital at nearly the same rates as older patients,
Wow.
and often require ventilation, often require complex medical intervention. Now, they tend to respond to that very well because they are younger and oftentimes healthier. But if you think of it in a way of utilizing resources, those young patients are taking up ventilators, taking up rooms, taking up supplies, taking up personal protective equipment and man resources that really fit better on those patients that have a much higher risk of mortality associated.
I think one of the things that scares me is, I'm about to be 37. I will be experiencing a birthday in shelter at home.
Mhm.
But while I think I'm reasonably healthy, there could be something unknown about me. And so
Right.
while I think I would have, I'd be on the spectrum of the mild symptoms, it could actually not be the case. And I won't know until it's too late.
Right, right. Yeah, and I think I saw one article about a 21-year-old otherwise healthy that had passed away, and in the article it said that he was diagnosed with undiagnosed leukemia, and so that he wasn't healthy. But yeah, there's certainly those circumstances. So there's a lot of those things that are not under our control, which is anxiety producing.
Hmm.
But again, I think that the facts it needs to be taken extremely serious, but also with a dose of reality that if we do what we're supposed to do, we can limit the spread of disease, at least to the point where our healthcare system can keep up with it. And
Yeah.
if you're relatively young and healthy, you're likely going to do fine with it, even if you get it. And so I just think, making sure that we take it serious and do the things we're supposed to do to protect society as a whole, but also being realistic about it, that it's something we can overcome too.
Well, and what I've been instructing people to do is if you think you're sick, just stay home and take care of yourself and manage your symptoms. And if it gets to the point where obviously if you're having trouble breathing, that's the time that you go to the ER because we just don't have the tests, so we don't know who's all got what. And so if you
Right.
can stay home and manage your symptoms, that's what we need you to do. But how can people treat themselves at home? What are you recommending?
Well, from a treatment standpoint at home, and typical normal stuff, keeping hydrated is very important. Just like with any flu type symptoms or viral type symptoms like this that are respiratory in nature, making sure that you can stay hydrated is by far the most important. Keeping your temperature down, using Tylenol. There's some suggestion that ibuprofen may be bad for COVID-19. I'm not sure what the science is actually going to bear out on that, but if there's concern about that, using Tylenol as opposed to ibuprofen is reasonable. And then if you continue to do okay and continue to progress and you're not having significant respiratory symptoms, staying at home is totally appropriate and preferred. If you're starting to struggle more and more, then having a phone call towards the state health department or your local emergency room, finding out what they think about it first before you come in is also a reasonable way to go also.
Yeah,
I
that's
think
we've been
making sure we
stressing
stay.
call before you show up
Absolutely.
so they
If
can
you think
prepare.
about it, the vast majority of folks that get a test have a negative test. A lot of those folks are presenting to urgent cares or emergency rooms to trigger that test being made. But if you're relatively minimal in symptoms and you go to an emergency room, that's probably the best way to catch COVID-19 is to go to a place where there's a big pocket of it. And so there's a decent chance that what you've got may not be that, but you might leave there with it. And so
Mhm.
relatively mild symptoms, stay at home, take care of it. I know there's always a major desire to know whether it is that, and that testing is something that gives people at least the information that I know that that's what I've got or what I'm dealing with. But in reality, it's not necessarily that important. What's important is if you're healthy enough to deal with it at home, stay home so you don't either get other people sick with it, utilize resources, or by heavens, get yourself sick with it because you didn't have it before.
Okay. And around the world, but even now in the United States, we're seeing big challenges for hospitals and our first responders and medical professionals. And I know we're worried about that happening here in Norman. So, how is Norman Regional doing with staffing levels and their own personal protective equipment, or as we hear a lot, PPE?
So at this point, from a staffing level standpoint, it's really a challenge to shift from a hospital system that was really a large percentage of an elective type hospital. We're doing a lot of orthopedic cases, general surgery cases, all kinds of other specialties, a lot of cardiac procedures that even those sometimes are considered non-emergent. To shift that staffing and kind of redirect that towards taking care of this pandemic, I think is a super big challenge that I think the health system has really addressed very well. It's very important for us to keep those providers healthy, especially our nursing staff that are on the front lines of taking care of these patients, our ER physicians and nursing staff there that may be treating or seeing these patients before we know whether they have it or not. And so protecting that personal protective equipment, making sure that our staff is protected in the appropriate ways as per the CDC guidelines, which our hospital system is doing a great job of making sure that they're informed about what those guidelines are and what the appropriate use of that material is. Certainly, there's potential risk of falling short on some of those supplies. The communities always, I mean, this is one of those other things that you see that we hear a lot of bad things about people in the world, but there's so many wonderful people. The vast majority of us are good. The vast majority of us want to do the right thing and want to help. And in certain times like this, you see that coming out. In Oklahoma, we know very well about that. Every springtime, there's potential for a tornado to come through, and the people that reach out to help people in those circumstances, it's no different now. So the number of people that sit at sewing machines to make masks, the number of people that try to donate things, like even my son, Blake, he's 15, he's got a 3D printer. He's been printing frames for face shields. We've got that approved through infection control at the hospital. And so we're the goal of producing 250 of those with 1,000 plastic shields that are disposable to go on top of those. And so that process is ongoing right now. It's very difficult stuff to get, very difficult to find the supplies. And so we're doing that. So then we
I mean,
continue to manage that. Go ahead.
Oh, I was going to say you gave a few examples of donations that Norman Regional has received, and I think we need to focus on those good stories. I
Absolutely.
completely agree with you. Uh,
Absolutely.
we are seeing the
Yeah.
best in people come out.
No question. And some of the things, the Norman Regional through the Norman Regional Health Foundation, which you can find online or through Facebook as well, has some donation recommendations on things that are really required or needed at this point, like hand sanitizer and sanitation wipes, that type of stuff. And Norman has had what we call a wash in, wash out program where caregivers are to wash their hands with hand sanitizer before going into a patient room and then after you leave the patient's room. And so a lot of these things are standard practice anyway, but it's a good reminder of how diligent we need to be about that on a daily basis. And so our hospital's covered with little sanitation or little machines that you can just get some of that on your hand. It's outside of every room. And so we've done a great job of that. We go through a lot of that too. And so to donate that, it's hard to find it online or in supply stores because everybody wants it. And so
Mhm.
you got supplies like that. Those things are really needed and wanted.
And I think today, what time is it now? Yeah, starting in I think 15 minutes, they are accepting donations at the Cleveland County
Correct.
Fairgrounds, 3 to
Correct.
5 p.m. Monday, Wednesday, and Friday. And again, the list of items that they have is posted on the Norman Regional Health Foundation website. I've shared it a few times, and I think we could probably put it in the comments of this chat. And it's got a great list. And again, more instructions of where and when to drop things off.
Right. Yeah. My wife's a dentist by trade. She's got a bunch of dental friends, and I've got a back truck full of supplies, and I'm going to go over and donate later today too. So.
Well, and to our stylists and nail salons, I know they've got some
Great.
protective equipment, and I want to urge you, if you're able, please make these donations. This is an unprecedented time in our community, and we will get through this. But right now, we need that Oklahoma standard, and we need all hands on deck.
Absolutely. 100% agree.
Well, Dr. Kirkpatrick, this is fantastic information. Is there anything else you want to share with us today?
No, I just want to just encourage everybody. This is an unprecedented time. The healthcare providers that are here in our community, don't waver one bit in taking on the mantle of taking care of our community, and we want to do that certainly safely. But we're in that position to do that, and we'll continue to be that for our community always. And this time will pass. We'll get past it, and the world will be a better place afterwards.
Well, I want to thank you so much for joining us. Thank you for your service to our community. We've talked about who the real heroes are, and I want to pass on my personal gratitude, and I hope you will share that with other medical professionals that you're working with right now.
Absolutely. Thank you very much.
You're welcome. Thank you all for watching. Please like and share this video so it reaches more people in your circle of friends and loved ones. Be safe out there, Norman.